Ngaji um,
พี่โดโดสวัสดีครับ
สวัสดีครับ เป็นไงบ้าง
ก็
โอเค ถ้าอย่างนั้นเราเริ่มเลยแล้วกันนะครับso for today class we have to cover four questions today, right? So you can see from the first question here, should doctors be required what? Wait a second here. Be required to work at a rural hospital for 2 years, right? And then after graduation, right? First of all, you need to talk about why, right? The reason why that they are required to work in a rural hospital within like 2 years. I have commitment after graduation here. And after that, you have to say the process after, do or things such work as a medical practitioners, right, at the rural hospital here, and what will make further contributions or even like the process later that you can become a professional doctor later, right? Okay, I'm going to give you for 5 minutes for preparation time, and then if you're ready, you can turn on the microphone. Yep.
โอเค In my opinion, doctor should be required to work at rural hospitals for 2 years after graduation. This this is because working at rural hospitals can improve doctors' performance and improve their skills too. Moreover, working at rural hospitals make doctors have more experience about how to deal with patients and how to treat the disease. Secondly, the reason that doctors should be required to work at rural hospitals is that the medical personnel at rural hospitals is always lack of. So I think that making the new doctors to go to work at rural hospitals can solve this problem, so that the patients can get can get the medicine faster than before. to sum up, I think that working at rural hospitals um, is benefit to both doctors and patients, so it should be required.
I see. I see your point here. So I understand that working at rural hospital, right, may have challenging or even difficulties for a young staff or medical practitioners at first after they graduating from medical school, right? So any difficulties that you can mention or raise awareness to those doctors who have to handle with this kind of situation after graduation and work at a rural hospital here? Mhm.
I think that the advice that I want to give them is to think it as the ways to improve themselves, because working at rural hospital it may it may it may not be comfortable when compared to working in the city,
Mhm.
but working at rural hospitals can make you have more experience um and and have more skills.
Yeah.
It can help with this more than in the city, um because the medical personnel at rural hospital is quite low, so you need to work a lot.
Mhm. All right. Thank you so much for your sharing here. Another question is that to those doctor students who finish or even graduating from private university, they may skip to do this kind of required work at a rural hospital. Am I correct? Or is that required to all of medical school students?
I think that it isn't required because um because the the private medical school fee is already high, so the medical student don't need to work to pay them.
I see, but they have to pass the medical examination. I mean, like, what is that certificate of? Yeah, right.
National license.
National license right here. Right? Okay, good. So to you, if you have to choose to work at a rural hospital, right? Which city would you like to do, and what the reason why that you have to do so? Yeah.
I think that the reason that I want to work at rural hospitals maybe about to help other people in rural area, because as you know, the people at rural area always have problem about their health, and there are not enough medical personnel in the rural hospital enough to deal with this problem.
I see. So it means that, but actually is a random, right? It doesn't mean that we can choose just because they're gonna random you to set or to allocate on staff in that provinces or even the required area. Is that right? I'm not sure, but anyway, working in a rural hospital it means that it can gain right lots of experiences or hands-on experience, challenging tasks, or you can face or encounter things that happen to the hospital, and you can understand or even realize that what will happen and then what you can do with lots of problems in that hospital, right? So here, I would say that you have to conclude the first question. The first concept is that the reason why, right, for working at a rural hospital, and then second is just try to share or share the ideas that working at the rural hospital may benefit to the doctor or even medical professional. Yeah. That's it, right? Okay, good. Thank you so much for your sharing here. Moving to second question here. So for this one is that it's a little bit conceptual late, right? Just because you have to say all of the things here. So choose the three different type health system, right? So namely that universal healthcare system, healthcare for civil servants, and social security system. So all of three have different differentiation and differences, right? So what you need to do is that you have to list between pros and cons, right? Of the three. For example, like why universal healthcare is a benefit, or even why we need to separate from universal to be healthcare for civil servants or even social security here, right? And then the second question is that possible to replace just only one universal system? So basically, I just want you to, let's say, like differentiate between universal first, and then try to connect with healthcare for civil servant and even social security system here, and then try to say if it should be replaced or not. It's okay? Yeah.
Okay.
All right. I'm going to give you for 5 minute preparation here. Né? Okay.
I I think that the three different type of systems shouldn't be replaced with one universal systems. The universal healthcare system is about is about the health system that every people in the country can get like the 30 baht campaign that you need to pay 30 baht to so that you can receive any healthcare in the public hospital and the healthcare for civil servants is like the private hospital that you need to pay some money in order to get a high quality healthcare service. And lastly, the social security system is about you need to pay to this system regularly, and when the time that you get some health problem, they will they will cover the medical fee for you. So the reason that I think the three different systems shouldn't be replaced with only one is because that it will it will make the patients at one universal system become too much. And this will cause a problem to the one with high money that want to receive a better quality of healthcare. They will not, if it is replaced with only one universal system, they will not they will not get the people with high money will not get a high quality system, and it could cause problem to the medical personnel too.
I see. So as you mentioned that so for the universal health system is all about like a campaign or even Ministry of Health, right? Just set up such a project or campaign to provide some facility to those people who can pay less, but they can get a lot of services or even treatment in that level, right? But for the the two is that healthcare for civil servants or even social security system is that you can go to the private university and then you can have such a services or even treatment from the private hospital too, right? But you can pay for some reasons for some causes of that payment too, just because this all about like the way you can get a better treatment and you need to pay things like that. Is that right? So I understand that just because we have to pay differently, is that right? And I mean like just what about is that important to say something about equality? Just because when it comes to treating or even having a medication, so sometimes people may want to have an equal, for their treatment or even services here. To you, do you think is that important to treat everything the same, but just separate a group of people in a different way?
I think that ideally it should be like that. It should be that everyone receive the same treatment, but in reality, the better quality of medical technology, the higher fee it is. And if everyone get high quality treatment equally, it will cause too much burden to the hospital. Yeah, so I think that we still need to differentiate the system
Mm-hmm.
in order to make some to make
Mm-hmm.
everyone uh, get get that treatment, but the 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 better
Mm-hmm.
the person who have high money
I
can get a
see.
better quality. Yeah.
You mean like it is easy for staff or even medical profession, right? To
Yes.
provide some services or even treatment to all of patients who can get treatment or go into the process of treatment here. Yeah, great. So anyway, try to explain the reason that we have to cover, right? Okay, so you mentioned a lot of things is quite great and very useful and informative here. But I would say that for discussion part, it might have a little bit, like debate between equality or even some kind of service that might be different um, just because the reason of the maybe a lack of medical staff or even lack of drug or even medicines, right, in that separate system here. So here we have to cover or even like try to explain what reason why. So you can say something that is related to social background or even money, right? Money issues, things like that too. Yeah, maybe. Okay, it's done for second question. I think that this is the big one, right? Big, issue or problem that we have to discuss for more, just because lots of information that can be shared here. Yeah, moving to next question here. Should Thai government place strict low limits on the amount of sugar, right? And can be used in snack and drink. So basically, you have to mention the problem about consuming or even eating snacks and drink for younger age or even children, teenagers here. And then you have to say, try to connect with this thing with the amount of sugar with high level, right? High level of sugar may cause what kind of diseases, right? You have to mention at least maybe one or two, for example, diabetes or I'm not sure, hypertension, things like that, right? Again, so try to say something that is a problem with snack and drink among children first, and try to connect with, let's say like get information, medical research about high sugar can cause such a problem with long-term diseases, things like that, right? Okay, I'm going to give you for 5 minutes here, and you can share your idea. Mhm.
Okay. Um, personally, I think that Thai government should place strict and low limits on the amount of sugar that can be utilized in snacks and drinks. In other words, Thai government should make the sugar tax. This is because high amount of sugar can cause many health problems to every people, no matter no matter what age they are or what condition they are in. High sugar can make people get obesity and some disease like diabetes. diabetes. And as you can see, the the people who get diabetes in Thailand is one of the most in the world when compared to the other countries. Yeah, so I think that limiting the amount of sugar can help relieve this disease because it will make people eat less sugar and it can make people behavior become better like if they consume a low amount of sugar in snacks regularly they will not need they will not want to eat the high amount of sugar anymore because they will be used to it. Yeah.
I see. All right. Good. So I understand that the Thai government should place a strict low limit on the sugar, right, amount of sugar, just because it can cause lots of problematic issues or even health concern, health diseases, right, from snack and drink. So basically, I understand that snack and drink, so for some manufacturer, they they have to add some kind of like ingredient, which is not only sugar, but some kind of, I'm not sure, maybe some color or even some substances that can make a snack or drink become tasty and, like lots of children can, attract to this kind of thing. Do you think it's important to strict or limit this kind of ingredients which is not likely to be just only sugar? For example, like colorful, right? Or some substances like can remain longer, things like that. Do we need to impose or even, have tax on this kind of thing for, snack and drink manufacturer? How and why?
Can you pardon me?
Okay, I understand that for this question is that they're going to focus on sugar, right? The level of sugar that can be added into snack and drink. But I understand that for snack and drink, it's not just only sugar that can cause many, diseases for people, right? So I just raised that there may be some ingredient, for example, like colorful that can be added into snack or drink, or even like some substances that can freeze or remain something to be just like that, right? Is that
Yes.
my question is that important to strict or even impose the tax to those who have manufactured this kind of snack or drink, just because it might be causing some problem for the children or consumers later? Yeah.
Yeah, I think that Thai government should limit this substance too because it may cause problem to people health. But as if I remember it correctly, Thai government already placed the limit on that substance, like
right.
the colorful product that isn't made from the plants. Yeah, it will most of it can be used in snack and drinks. Yeah.
All right. So I just want to know what is the top health problem that caused from a high level of sugar? You can raise maybe one or two or three. I mean, okay, so yeah, right.
I think that the problem that will come from sugar, that the first problem that is undeniable is diabetes.
Diabetes, right.
Yeah, because
Type 1, type 2, right? Okay.
yeah, diabetes type 2 because it will make the sugar in your bloodstream become high and it will cause your function in body to resist it and it will cause diabetes. Yeah, and secondly, the problem that will come from sugar is about the obesity because as you know sugar contain um high high energy and if you don't exercise regularly this sugar will become fat instead and it will store in your body.
So what about hypertension? Just because I understand it caused from sugar or high level of sugar too, right? Am I correct? Hypertension, yeah.
Yes. Yes. When you have diabetes,
Okay.
and you don't treat it correctly, it will cause hypertension and other problems too.
I see. Good. So it's just kind of like the subsequences when it caused from the diabetes, and then you can may further develop a hypertension later. Am I correct? Yeah.
Yes.
I see. All right. So I would suggest for the third question here is that maybe you can generalize from the children or obesity, let's say like fat children or obesity children that they consume regularly for snack and drink with a high level of sugar here. Let's say like you try to say something for, the amount of percentage or even the large proportion, maybe in Thailand or even in overseas in USA, in a Western country, right? It might show a statistical report here, things like that. Maybe I would suggest for more, right? Okay, good. Next, I'm going to, the last question here. Should patient medical record be made available online to Thai medical researchers and relevant staff at the Ministry of Health without the patient consent form, right? Okay, I'm going to give you, so for this one, I think that it is not allowed to do so. Am I correct?
Yes.
Yes. All right. So when it comes to say something that no, you have to explain the case scenario a bit, why it caused like that, and how to prevent this kind of problem happen again and again. Is that okay? Just because we have to say no for the last question here, right? Is that right? Okay. Okay. Again, right? Try to raise some example, right? Maybe case report on what happened to it. This kind of patient consent that is relevant to medical record or even information, or some kind of thing that cannot be exposed to the public. Yeah. All right. I'm going to give you 5 minutes here, and once you're ready, just turn on the microphone here.
Okay. As far as I'm concerned, patient's medical records should not be made available online to any people. This is because it is about the it is about the patient's secret that need to that need to not be revealed to any website. As you know, the medical records is some kind of patient's property, and it need to keep it as secret to any people. Like it's about to respect them. Yeah, so I think that no matter what organization want it, they shouldn't be reviewed. And maybe if the Thai medical researcher really want to use the record, they should ask the patients first whether they want to review it or not.
All right. So it is very strictly prohibited to review any patient medical records to be made as available or even online, right? Just because it's kind of like a patient confidential, right? Confidential from what they have a problem, let's say, or even the, this is kind of thing that you cannot even expose to the public, just because they may have a chance of that doing so, right? So just because just because the process or even procedure while doing treat some patient, right, or even things like that, this is kind of like very strict that the doctor have to let patient sign such a consent form. Is that right? Just because it can be avoid or prevent from such a future suing or any kind of a problem that may happen to the doctor here. So when it comes to a problem, for example, like it is mistake from the doctor or even any operation from a doctor that it can cause a problem. And then it can, some kind of like a patient may dissatisfy with this kind of process and they can sue later. So, but the patient have already signed a consent form. Okay, I just, raise some scenario here. So the problem is just because the patient signed consent form already, but the mistake is direct to the doctor. Is that possible to negotiate, or what do you think about this case?
I think that if patients already sign the consent to review their medical records, I think that in this case, it will not be the doctor's fault anymore, because patients already admit that they can review their records to other people. Yeah, and if patients are sue the doctor for that reason, the doctors can always sue back to the patients that they don't that they don't
understand,
they
right?
they don't respect their consent.
So it means that for a patient consent is very important towards a doctor operation or even doctor treatment to the patient, right? It's not just only prevent a doctor from any kind of mistake or even wrongdoing, so, but it's just kind of like a respect to that treatment of the patient, just because to the side of doctor, we can provide some treatment just because we want to treat the illnesses from the patient. Is that right? So it means that some kind of error or even mis-experimentation, I mean like a experiment or even this kind of thing may happen, but the patient have to accept or acknowledge this kind of thing that can occur in the future, right? More or less here. Good. All right, so it's time for you. You have to summary for the question number 1, just briefly summary, right? Just because I just want your idea in each question. First, 1 and 2, 3 and 4. So again, right? You have just direct to the question yes or no and give a reason why. Yes or no and give a reason why. That's it. Okay? Yeah. Okay. I'm going to give you preparation time a bit, and then if you feel free to talk, just turn on your microphone here.
Okay. For the first question, I think yes, the doctor should be required to work at rural hospital for 2 years after graduation. The reason is that working at rural hospitals can make doctor have more experience and more skill in the medical field, and moreover, it will benefit the patients too, because the medical personnel at rural hospital um are always not enough when compared to the patients. So making the doctor work at rural hospital can solve this problem, and the patients can get better treatment. Yeah. And for the second question, no, the 3 different type health systems shouldn't be replaced with only one. This is because making all system to only one universal system will make people who want to get high quality treatment will not receive it, because one universal system will make every people get a same treatment. And the treatment will not be high quality, because the high quality treatment require require high money to spend. So if the high quality treatment become free, it will cause too much burden to the hospital. Yeah, to sum up, the three different systems should still be remain. Yeah, because it will make people get it will make people have more than one ways to get a treatment.
Uh-huh.
Yeah, and for the third question, I think that Thai government yes, I think we should include the sugar tax to the country. The reason is that sugar tax can make people eat less sugar than before, and it will make people have less problem about some health problems like diabetes or obesity, since sugar is the main reason that cause this disease. Lastly, um, no, I think that patient's medical record shouldn't be available for the medical research without patient's consent. The reason behind this is that it is about the patient secret, like their record is their secret, so making it available for every people will be like not respect the patients. Yeah, and we shouldn't do that because doctor should respect patients. Yeah,
I
and
see.
if people want to make the if some researcher want to use patients medical record, they should ask them to fill a consent so that patients know whether when they will whether the record will become available or not.
All right. Thank you so much for your sharing here. Good. So for my constructive feedback for your speaking for today, I think I can say that for two part of the speaking evaluation based on the, the paper mentioned is that fluency or coherency or even the detailed content and informative information here. I think you achieve the two aspects of the core content or the reason why that you can explain for a discussion part here, and also the way that you connect every detail, every single idea to each other, right? Introduction,
Yes.
coherent, cohesion, or even conclusion here. So you have achieved for two aspect already. I would suggest that you have to change a bit the way to speak. For example, like if you say yes, we can say absolutely instead of yes. Okay. Or even if you strongly disagree, so you can say, to me, I strongly disagree instead of no. It might be like a new way to say something flow for speaking, right? This is a recommendation or suggestion, right? And anyway, the reason or the supporting detail is quite good and great. You can talk and explain a bit. And also, I would suggest for more is that you can start with the case first, just because I would say that it's all about a problem occur or even something happened already, and we have to share some solution that may prevent or even deal with this kind of problems together, right? Okay, this is my suggestion. Maybe further develop for the next question that we are going to see for tomorrow, right? And also that your speaking is quite good, but anyway, just because it's a detail, right? So we need a time to think about it first. So I would suggest that if you cannot even reply or share the idea immediately, right? So you have to, let's say, use some expression. For example, like to my point of view, right? In my opinion, or even back into let's say like the previous case scenario, or according to the research, according to statistic, according to WHO, things like that, right? Okay, so here is this kind of thing that you can, prompt into the detail or answer properly here. Yep. นะภาพรวมก็พี่คิดว่าอย่างนี้คือตัวไอเดียพี่ไม่ค่อยแตะเท่าไหร่เพราะคิดว่าเราน่าจะมันคงคล้ายๆกันนะครับแต่ว่าพยายามแบบโยงให้มันเป็น analytical thinking นิดหนึ่งก็คือในเรื่องของดึง research base หรือว่าเป็นแบบ case study มานิดนึงนะฮะสำหรับข้อตัดไปแล้วกันนะฮะแล้วก็ค่อยโยงสำหรับ how and why นี่ก็ต้อง fix อยู่แล้วนะฮะเราต้องตอบอยู่แล้วนะโอเคส่วนgrammar ไม่เป็นไรครับผิดบ้างนิดหน่อยมันเป็น way ของ communication นะครับไม่มีปัญหาแล้วก็สุดท้ายคือในส่วนของ pronunciation เนี่ยเราอาจจะยังพูดช้านิดหนึ่งไม่เป็นไรก็คือเดี๋ยวให้ฟังไปเรื่อยๆเดี๋ยวมันก็คงflow ขึ้นมาเองนะครับภาพรวมวันนี้พอได้นะ
พอได้
โอเคสู้ๆพี่งั้นวันนี้พอแค่นี้ก่อนแล้วน่าจะเหนื่อยแล้วเดี๋ยวเจอกันพรุ่งนี้นะเดี๋ยวพี่ไลน์ไปบอกก่อนคลาสก็นิดหนึ่งนะฮะครับผมสวัสดีครับบ๊ายบายครับ
พี่โดโด